So I'm a horse girl. I've loved horses my entire life. I was either always going to be an equine veterinarian or a pediatric dentist. So when I got to design my own office, I just incorporated my love of horses into it from the get-go. There's a phrase, it's my tagline, but it's not my line. Children and horses don't care about how much you know until they know how much you care. I don't have TVs on my ceiling. I don't have ear pods for everybody to put on. We actually try to build a relationship with kids. I think relationship is a very important thing, and we try to get to know our families. So that's my goal, is always to get to know kids as best I can, as fast as I can, so that our lives, while they're intersecting, are authentic. Our communications and our interactions are authentic. College Pediatric Dentistry started in 2005 on my day off. So it was my hobby practice. It's got 2 locations now, but I started out with 1 location in Littleton, Colorado, and then in 2012 opened up a second location up in my hometown of Evergreen, Colorado. We kind of consider ourselves a herd. We love seeing our patients from infancy through college. We can take people in and get to know them as families and walk beside them for the, I'm gonna say 20 years that we know them. We take everybody's photo about every 2 years or so. First visit, and then every 2 years or so. Every time we take a new photo, the first thing families want to do in consult is walk back over the years and look at all the photos all the way back to the first visit. And it's so funny because 8 times out of 10, that first photo is like this kid like, you know, they're just about to lose it and they're staring at a webcam. And because we haven't done anything yet, they haven't learned to trust us yet. They haven't learned that this is fun and easy. And then, then they start doing the goofball pictures as the years go on. And we just use that feature to keep track of these kids and make sure that they know that they're known. But in consult, they love it. It's a value builder. There are about maybe a fifth of my patients that are equidistant between the 2 offices, that depending on the day of the week or the sport or the time of the year, they'll vacillate between the 2 offices. So I use one database. Another thing that's awesome, my mom is 81 years old and she does my billing remotely. And a new patient phone call comes in, they go to someone who's in their home where it's quiet, where you're not listening to an office operating in the background. So all of our new patient calls get booted out to them, farmed out to them immediately so that they can spend the 10 minutes on the phone with these new families and get to know them a little bit and not be interrupted with other office sounds. When you call our office, you will not get a voice message. You will get a person who answers the phone. That's very important to me. The only time you'll get a voice message is if it's after hours. That will direct you to my cell phone for emergencies, and the 1 hour during lunch where you can leave a message in between so that we can obtain that message right away as soon as lunch is over and get you called back. So that personal touch is really, really important to me. The texting was a hard sell for me because of the importance of the personal touch. Then the world changed and parents quit answering their cell phones. And so I was convinced by the folks at Practice Web that this might be a good thing worth trying. And I did on a trial basis, and it's worked very, very well. We've made it personal. We personalize all the messages that go out on text. It has to sound like Courtney speak. And once we do that, we've had great response from it. Everybody always gets a birthday text. I get lots of replies thanking our practice for the birthday wishes. And I'd say 80% of our families understand how to confirm back into the software via a text. And when they don't do it and they've heard us leave 5 voicemail messages that they haven't responded to, when they come in, we just say, press this little C right here. And we're done harassing you. We know you're coming. So it's training of some of the families, but for the most part, it's worked out really, really well. I was probably in a practice that was one of the first 100 users in 1998. I like Practice Web. I like them because they were the first ones to be online, and I love them because their customer service is the best. I think over the years, just as you've developed the software, I've appreciated the developments on it, and some I've had a hand in, others I have not, but I appreciate the intuitiveness and the malleability of it and the customizability of it. back in the days when we could actually go to meetings, I always peruse the convention hall and I always look at the dental software, and nobody has any offerings that, even there's a couple companies that are cloud-based that are pediatric dentistry specific. And I've spoken to them and I've looked at them, and they don't have any offerings that I don't already have with Practice Web. But I will tell you, they're a lot more expensive. And when I'm getting records in from other offices too, I can tell that other offices have staff that have a hard time like exporting a series of x-rays or giving a full set of progress notes without fees in them and extraneous notes. It's either difficult to train staff to do that correctly, or it's not doable in some of these other software systems. I very much appreciate Practice Web when I'm getting records from other offices for second opinions and transfers. Yeah. What we send out when kids transfer out of the practice is also another top-notch thing. Super customizable, super comprehensive, easy for the next office to pick up where we left off. That's a big deal. It presents our practice as I want it to be presented to others. So.